Nursing right now is in a very unique, challenging position. It's exciting and it's daunting, preparing enough nurses to be able to practice. At the University of Rochester, developing clinical-ready nurses is a priority for all of us, and having tools that allow us to do that from multiple fronts, I think really gets at that clinical readiness. Our strategic approach to technology here at the University of Rochester School of Nursing was to not only embrace technology, but integrate it in all parts of what we do.
Recognizing the shift to competency-based education, we saw technology as really the strategic enabler of learning, and so we wanted to produce graduates who are nurses as knowledge workers living in a digital age.
In New York State, we are permitted to use a third of our hours as simulation hours. That is really a game changer for us.
Virtual reality and virtual simulations are going to help build competent and confident nurses because they are able to experience realistic clinical scenarios.
In a virtual environment or in a simulated environment, we feel it's really critically important to create psychological safety. If a student does not have psychological safety, they really can't engage in their higher order thinking. And so what we really try to do is create an environment where they know that it's okay to make mistakes.
The VR clinical simulation really works on getting you that clinical practice without actually being on the floor with real patients. And you can repeat that scenario over and over again, which is really nice because you don't have a rewind button in the real world.
One of the advantages of vrClinical is that you can give students an opportunity that they wouldn't get in a clinical rotation. When you go to clinical sites, you get what you get. And when you use a simulation tool like vrClinicals, you can make sure every student gets a similar opportunity to see some very important high-yield content.
So with simulation and virtual reality, even though you may make a mistake, you're learning from that mistake, and that is going to make you a better, safer, more competent practitioner.